Viruses. When people hear the word virus, most people think of a harmful pathogen that makes them sick. But what if viruses could save people's lives? This leads me, as well as other scientists, to ask the question, could genetically modified viruses kill cancer cells? Many scientists and oncologists have tested genetically modified viruses on patients and had success. These viruses are genetically modified by splicing parts of their DNA to make the virus only attack the cancer cells. Injecting patients with viruses sounds frightening to some people, but the virus only targets cancer cells, not the healthy ones. Genetic engineers are the main people who would genetically modify DNA of viruses. Genetic engineering is a growing profession. Many genetic engineers get paid well, with salaries ranging from $50,000 to $110,000 a year. Facilities are using many different types of viruses to kill cancer cells. The Mayo Clinic in Rochester, Minnesota is working on using the measles virus to kill cancer cells. While in Columbus, Ohio, at the Nationwide Children's Hospital, researchers are using viruses such as herpes and the common cold to treat or potentially cure pediatric cancer. Many universities, such as the University of Minnesota, Twin Cities, and the University of California, Los Angeles, are also researching ways to use viruses to cure cancer. Many people have had success, and their cancer has been killed by viruses. One patient at the Mayo Clinic, Stacy Ernholz, had a tumor in her brain. With a strong injection of a genetically modified measles virus, her cancer went into remission. Many people would say one success story does not make a miracle cure, which is true. More research must be done. But many people, such as 7-year-old Emily Whitehead from Dallas, Texas, beat their cancer using viruses. Emily is still in remission to this day. Viruses are bringing new hope to families whose loved ones are suffering from cancer. Chemotherapy and radiation may not always be enough for some cancer patients. Radiation and chemotherapy cause discomfort and severe pain when applied to patients. By using genetically modified viruses, cancer is targeted, and many of the side effects are less severe. Stacy Ernholz, the patient from the Mayo Clinic, said her side effects were only a fever and a headache, compared to the severe pain and nausea from chemotherapy and radiation. Cancer is a devastating disease which affects people around the world, and many people know at least one person who is suffering or has suffered from it. Viruses can bring terrible devastation, such as the measles epidemic or the smallpox, but can also be a cure to an even worse evil, cancer. By genetically modifying viruses such as HIV to kill cancer cells, many lives can be saved and make up for those lost from the terrible viruses.